It's a great privilege in order to be able to support Budget 2019. Mr. Speaker, Budget 2019 displays the coalition government's willingness and dedication to the improvement in quality life for all Guyana. Mr. Speaker, this budget expresses equality and includes fair distribution of resources allocated to all Guyanese. To all Guyanese. Mr. Speaker, in Budget 2018, we would have seen the region receive just over $2.6 billion. Here in Budget 2019, we have seen Region 1 receiving just over $3.4 billion. Mr. Speaker, I would like us to look at some of the benefits included in Budget 2019. But before I do so, please permit me to take this House a little down memory lane. Mr. Speaker, in 2012, 2013, GINA quoted a minister then, and who is a sitting member in this House, as saying, it is going to be a very good day for the village. This was quoted by the minister. And that minister was the Minister of Indigenous Peoples Affairs. Minister,
don't worry about it. You speak, don't worry about it. She's not the speaker.
Minister Lowe yesterday in her presentation that cited to the Hassa fish farm in Region 1. What minister did not say to us was the fish farm that was established, or GINA put it, that one minister was carrying out in Region 1. And that fish farm was to be established in a place by the Tobago Hill.
You understand what we said?
Minister, Mr. Speaker, under the National Secure Livelihood Project in Region 1, GINA quoted the honorable member as saying that the farm would have been ready by the month of July to harvest. This project was a project that had some $88 million which was extracted to it. But you know what, I heard persons here keep shouting about the AG's office. And I would like to ask in this House, where was the AG's office at that time? They was not functional? Mr. Speaker, I heard today where Dr. Frank Anthony, who was saying that residents and citizens have to be waiting at the PHG hospital where they don't have beds and people doubling up. But I would like to say to this House, there are persons in this National Assembly here that I used to be calling. In 2012 and 2013, I stayed and called while persons were sitting in chairs, waiting because they don't have beds. That is not a now something. It is something which is inherited from the PPP administrator.
All right, Frank. We are
working to changing it, but you're trying to say that it's now happening. It now happened. It never happened under your administration.
Honourable members, Honourable Member Mr. Allen, you must address your remarks to the Speaker, to the Chair,
Thank you.
and to no one else in the room. Thank you.
Thank you, Mr. Speaker. Mr. Speaker, I know that all the works and the projects that the APNU AFC government has been executing since we took office, we would hear that the opposition going around saying to persons, oh, we had those projects in mind. Those are our projects they're executing. But I'm not hearing them claiming the 5 Bs. And I'm saying, Mr. Speaker, Budget 2018, we took a look down the line of what Region 1 would have gained from Budget 2018. No more the people have to complain about bad roads and protest about bad roads. They now have concrete roads for the first time. And still I can have persons from in this assembly from the opposition going around and saying to persons, we had that. One member was quoted as saying to persons, what are you going to do with concrete road? But that will help them not to complain no more and it will live out your lifetime. The concrete road will live out your lifetime. Mr. Speaker, we've watched situations in Region 1 where $60 million were given by the administration. You have one MP here who was the PS and an MP here who was the minister at that time. Administer, Mr. Speaker, where was the audit office? Nothing like that ever came up.
All right.
The Auditor General, we've seen nothing came up about that. Yes, Mr. Hamilton. Mr. Speaker, the Barmeter residents are now great with a sigh of relief. And who brought about this? The coalition government. They are driving freely within 1 hour from Matthews Ridge to Barmeter. This was done by the APNU, AFC government.
Not PPP.
Mr. Speaker, the health sector, Barmeter, which had never been taken care of by the previous administration, Barmeter now posed with that health facility have 2 doctors, while they had none.
Strip and slap.
2 doctors at that facility, Mr. Speaker. They were trained by and using Guyanese taxpayer money.
Yes, right. Guyanese taxpayer money.
They weren't trained by you,
Right.
Member Durham.
Good.
Mr. Speaker, at the Mabruma Regional District Hospital, we now have specialist doctors stationed here, which save the region and the nation as a whole large sums of money because we don't have to do medivacs so often.
All right.
I took it to Dartmouth. People don't have to travel to Georgetown where they don't have relatives to look after them and have to stay along surgeries. These minor surgeries are done right in the region because we now have special doctors. And this is caring by the government. Mr. Speaker, I will now spend some time and look at budget 2019. Coming out of budget 2019, Mr. Speaker, we will see the establishment of a radio station. This radio station will increase community coverage, and even as while Radio Mabruma was established, and the regional administration and the PPP colleagues said to the people, don't go to the opening because they have nothing for you. They don't want the people to be educated. But we are going to establish projects and programs through our radio stations so we keep them informed. We will look at public infrastructure, quickly at electricity. Mr. Speaker, coming out of budget 2019, we will see the expansion and upgrading of distribution network, provision for underground cables. We have the age-long bridge at Moruca. All will be done under public infrastructure, central government. We can't leave it under the region because nothing will be done. This bridge, which will improve accessibility for the residents of Moruca by you getting that bridge. Roads, we will see several roads across the region completed, new roads construction of new roads and rehabilitation to community roads and also municipality roads. Provision for community organized for restoration, the environment and employment of youths. This is also being done on the public infrastructure. On the Ministry of Communities, Mr. Speaker, we have seen water. Yes, you have the defeat, but what you're going to do? Stifle projects. That's what you do, stifle projects. Mr. Speaker, we have now seen water through taps in the Maracay sub-region, which never happened before. And I remember in 2012 when I asked the then minister responsible for water in this house, while he spoke about the amount of money he spent on water, if he would have gone downstairs and used the water from the tap down there, there was annoyance. But I'm saying now, Mr. Speaker, that we have residents in Region 1 who can go to the tap and drink that water without having a problem.
All right.
And this is done through the coalition government for the first time.
For the first time.
this is what we've seen of improved health and conditions for the people. Mr. Speaker, on the public health, we will see that persons, the dirty contractors that you had,
Honourable Member,
we had to get rid of them.
Honourable Member, you have 5 minutes remaining.
Thank you, Mr. Speaker. We will see the new program of intervention, Mr. Speaker, for HIV and AIDS, which will be trained, tuberculosis. And when I looked at this, what the ministry plans to do with tuberculosis, it reminds me of the same area, that village, where the Asa farm was to be established. The doctors refused to go there to look at the people because they said they have TB and they could get TB to the whole. Minister Jen Berry had to go in the region and direct them that they must go. So persons are going to be trained now. We will see better dental care. And Mr. Speaker, we inherit a situation, you imagine that we have health centers which don't have a measuring board for youth.
Don't worry, these are far.
Dental chairs at facilities, we inherit none. We will now have those things in place.
Yeah, never before. Never before.
Sterilizers,
Only Asa farm they had.
compressors, X-ray machines,
Tell them.
and measuring boards, all will be distributed in Region 1 out of budget 2019.
All right. No more Asa farms.
We will also see, Mr. Speaker, the completion of major works at the new hospital in Roanoke, construction and of the nurses' quarters, which will be completed because we have gotten rid of those contractors that Mr. Hamilton would have had with us.
Hamilton's contractors. Those sleaze.
Well, yes, Mr. Speaker, I would like to commend this budget
Yes.
to this House for safe passage. Thank you.
All right.